Hi, today we're going to talk about pressure gradients and resistance in blood flow. So the blood flow through a vessel will depend on the pressure gradient and the vascular resistance. So when we're discussing the flow rate, as resistance increases, the flow rate will decrease. So if we look at this mathematically, the flow of blood through a vessel is equal to the pressure gradient divided by the resistance of the blood vessel. So above is our mathematical formula for the flow rate, and the little triangle in front of the P is your pressure gradient. The R stands for resistance and F for flow rate. So it's just simply the pressure gradient divided by the resistance. All right, if you look at the vessels in the slide, you will see one is 1 millimeter, the next down is 2 millimeters, and the next down is 4 millimeters in diameter. And the chart will show the amount of blood in the red bars to the right. So the 1 millimeter vessel will be hard for the blood to pass through. You barely see any, especially compared to the 2 millimeter vessel or the 4, which is greatly increased. So if you look at the diameter, there is a substantial blood flow through the 4 millimeter vessel as the diameter increases. Blood pressure gradients are ultimately responsible for the flow of blood within a particular vessel. So a blood pressure gradient refers to a difference in blood pressure between 2 points in the vascular system. So note that the absolute value of blood pressure at these points is not relevant to blood flow. So the only value of importance is the relative difference in blood pressure between the 2 points. So blood flow will always occur from a location of higher pressure to a location of lower pressure. The vessels, we call this a gradient. The vessels start with higher pressure flow initially. If you look on the slide to the left, you'll see where the high pressure goes in, and the pressure gradient decreases by the time it leaves or comes out the other end on the right. Things that influence resistance are the vessel diameter, the vessel length, the blood viscosity. So pressure gradient is the difference from the beginning and the end of a blood vessel. So we're looking at each end of the blood vessel and we're taking the difference in between the two. And we know that in an area of higher concentration, it will flow to an area of lower concentration in a gradient. The contraction of the heart rate is the main driving force of blood flow through the vessels. The frictional losses, we call these resistance, and the pressure will drop as blood flows the entire length of the vessel. And the pressure will be higher initially and less at the end. This establishes a pressure gradient for the forward flow of blood through the vessel. So take note that I said the forward flow of blood because your venous valves prevent blood from moving backward into the veins. So an excellent example is an everyday garden hose. So when you attach it to the faucet for your source of water and you turn it on and a small stream flows out the end of the hose. If you open that water valve all the way, the water comes out much faster. This increases the pressure gradient. I think the water hose is probably the most understandable example that we have all dealt with. Resistance, which we stated, is an opposition or something that slows a process down by friction between the vessel wall and the moving fluid. So when resistance increases, it is more difficult to pass through and the flow rate decreases. This is if the pressure gradient stays the same. So when resistance increases the pressure, the gradient must increase to maintain the same flow. But when the vessel offers more resistance to the flow, the heart must work harder to maintain circulation. So we have a formula where the resistance is directly proportionate to viscosity and vessel length. It is inversely proportionate to vessel radius. So the peripheral resistance is the friction between the blood and the vessel wall. So if you look at the top two vessels, the top has a much smaller diameter than the second vessel. So 10 milliliters of blood is in each vessel. The smaller vessel has more surface area that comes into contact with the 10 milliliters of blood than the larger diameter directly below it. Our radius is the main determinant of resistance. That's a very important point to make there. So now let's look at vessel 1 and 2 right below that. They both have the same pressure gradient. So note that the radius in vessel 2 is twice that of the first vessel. And the resistance in vessel 2 is 1/16 of the first. But the flow in vessel 2 is actually 16 times that of the smaller vessel in 1. So the flow is faster in the larger vessel compared to the smaller. And that just makes sense, especially if you think about your water hose. So the more resistance, the smaller the flow, and vice versa. So resistance to blood flow is a property dependent on the physical characteristics of a segment of the vascular system and the blood flowing within it. So quantitatively, the resistance to blood flow is the difficulty of pushing it through a section of a blood vessel. The viscosity refers to the friction between the molecule of fluid as they slide over each other in the flow. And when the liquid is thicker, there's a greater resistance and therefore the greater resistance to flow. So a good example would be a really thick syrup like you see on the right compared to water as seen on the left. The thick syrup would have a greater viscosity because it would flow much slower than the water. The number of red blood cells circulating determines the blood viscosity. So an excessive amount of red blood cells that cause a more sluggish blood flow can be a problem. So the greater the blood vessel surface area that meets the blood, the bigger the resistance to flow. So the surface area is determined by the length and the radius of the blood vessel. At a constant radius, if there is a longer vessel, then the more surface area that is covered. And since the vessel length does not change, it's not a variable and a factor in the equation because your vessels in your body are already predetermined. They're not going to change. The main thing we look at on determining the resistance is the diameter of the vessel, remembering that that's all the way across the opening of the vessel. It just makes sense that it would be easier for a fluid to travel easily through a larger vessel than a smaller one. And the surface area of a smaller vessel, since more blood actually encounters the wall, would create a greater resistance. So we're looking at a slide where the blood cells flow freely and one where there is resistance. So what does the one with resistance look like? So which slide do you think has the resistance? Yes, the one on the left. And do we think this could be a blood clot forming? Yeah, looks like it. And the primary method by which materials such as oxygen and carbon dioxide, as well as nutrients, are exchanged are between the blood and the surrounding tissues with passive diffusion across the capillary wall down their concentration gradients. So if we want to just do kind of a quick in general summary, we know that our blood pressure is the push or the force of blood in your blood vessels, and the highest is being in the arteries while the lowest is being in the veins. And when we talk about the blood pressure gradients, we're referring to is the difference between two blood pressures. And when we talk about the difference between average blood pressure, we're referring to the pressure in the aorta, pressure at the termination in the vena cava. And our blood pressure gradient helps the blood to circulate. While our heart pumps, it is still necessary for our vessels to help. So some definitions that we need to know are things like hypertension, which refers to high blood pressure. And if a blood pressure gradient is not present and the blood pressure does not circulate, it would lead to death. And the things that influence blood pressure is the blood volume, strength of the heartbeat, the heart rate, thickness of blood, and resistance to blood flow. So what would produce the greatest change in blood flow? Well, we saw earlier if we doubled the radius of the vessel, that would be the greatest change in blood flow. These are the different works that I cited for this PowerPoint. Thank you.